We're here today at the Brookdale Club to celebrate the LINk's AGM. Of time, and we weren't getting through our business, so we decided to trial some LINk briefing sessions where we invited key speakers and key professionals from various statutory organisations to come and tell us about new developments, new service areas and things that we're...
But just before I get going, who's from Reddish or Biddington way? Yeah? Okay, good. Heaton's? Right. Marple way? Yeah. Bramall, Cheelhume, yeah, quite a lot from there. Anybody from Kale Green, Davenport, Bridge Hall, etc. Yeah, so we've got a fair mix, and the wet. Well, by themselves, and if they want to, gold plated model, they can pay extra.
What about the cost of drugs that are in people's bathroom cabinets? Untouched, unused, and when people die or hand them in.
Health Watch will be a consumer champion at both a local level and a national level, which before we've only had at a local level.
To my mind, it went very well because it had different aspects to it in terms of providing people with all the information which was provided by the local authority people and the PCT people. So the informational content was there, and also people had all the opportunity to ask and contribute to whatever extent they could.
I thought this year's AGM was very, very good, very enlightening, much better than the others.
I thought the AGM was very informative and the speakers explained their jobs very well.
I wanted to join the core group because throughout my life, and I've worked in the health service, and I've worked with the health service, outside the health service, and I've often said to myself, I could do that better. Why don't they do this? Why are they doing that? As a core group member, I think I'm in a good position now to actually question things that are done, changes that are made, and perhaps influence them in a better way, in the way that I've always said I'd like to. And that's why I decided to join the core group.
The thing that we did this year was to get into the hospitals to do entry review, which was a major strike for the group.
The biggest success of the LINk this year has been we're just beginning to get onto the helping with the decision making of the PCT with these programme boards that we're on.
The greatest achievement is that we have got the hospital, the council and Stockport NHS to appoint outside consultants to address the issue of discharge processing, because we're told by the Foundation Trust that it's costing £2 million per year, which could be recycled into care for our patients.
Yes, I'd like to add that I second everything that's been said, but also I note that in the quality care for Stockport Foundation Trust, discharge is put as a priority and named as being at our request, the LINk request. I would also say that it is one of the top priorities for next year.
The greatest success of the LINk this year, as you've seen today at the AGM, was the getting together of everybody. Good minds, good people, good thinking. And I think that's a great achievement that we've kept so many together.